Hey guys, it's been a few days since I've made a video, but I want to talk about preparing for implants today. I was going to talk about preparing to have them exposed, but I wanted to do this video first. I've got implants on top, which I've said in a couple of my videos, and I've still got my bottom teeth. I've got 8 teeth left on bottom. They're not in the best shape. I'm going to have them done sooner than later because my gums are receding really, really bad. But what I want to say here is, if you are somebody that has a top and bottom plate, just a top and bottom denture, and you are wanting to have implants put in, but let's say you only have the money to do half of your mouth. Say you only have enough money to either do the top or the bottom. My advice to you would be to keep your plate on top and to go ahead and have the implants put on bottom. And the reasoning is I don't know. All I know from bottoms is what I've heard. And I know that a lot of people have trouble with their bottom denture floating. Not everybody. Some people get used to it and don't have any trouble. But it's more, it's not hard to keep the top plate in with glue because you've got more stability up there. You've got the roof of your mouth. Like right now, I'm not even using my implants on top. I've been gluing it in since I've had them because there's a process that you go through. You get the teeth pulled. A lot of times the dentist will want you to heal. Then they'll do the implants. Then you go back a couple months later and they expose them. This process can take almost a year. But I've had no trouble eating or chewing by gluing my top denture in. So if you have a choice, or if you can only get either the top or the bottom done, definitely get implants put on the bottom first. You can, and then you could always save up and do the tops later. And I almost wished I would have done that. I only had 4 teeth left on top, and my bone was starting to deteriorate pretty rapidly. So that's kind of the reasoning why I went ahead and had my tops done. And that's another thing. If you are in, say that you've just had your E-Day and you've had your extractions and you've got no implants, you just got a top and bottom plate. If you are thinking that you are wanting to get implants somewhere down the road, you cannot wait that long, because as time goes on, you have bone loss. And like from where I went for so long without teeth in the back, and then I had the ones in the very front pulled, my bone started deteriorating rapidly. I've only got mini implants. If I wanted to get the full implants, they would have had to do grafting. So it's not something, if this is something that you really want to do, it's not something that you can wait around and mess around with. It just happens. Also, as far as for people that already have their implant day scheduled, and you say you're going in to do your extractions, and you've got your E-Day scheduled and you've got your implant day scheduled, I want to tell you that to make sure after your procedures, like after your E-Day, if they put an immediate denture in, make sure you keep your denture in. especially the day of surgery. It's after extractions and after implants. They will put your plate in immediately after that. It's very important that you keep that plate in. Because what's going to happen is the night of the procedure, you're going to have some pretty significant swelling. If you take that plate out before you go to sleep, when you get up the next morning, you won't be able to get it back in. So that's something that I'm really glad that I did. I mean, I was uncomfortable, but they told me before I left the dentist, whatever you do, make sure you keep your plate in, at least until the swelling goes down. And as far as for your swelling, ice packs, ibuprofen. I mean, ibuprofen is so important. They'll probably give you pain medication, but I would take, if the pain medication doesn't have ibuprofen or acetaminophen in it, I would take ibuprofen as well, because that's what takes the swelling down. And I think that helps with pain better than the pain medication. But I think I had to end up taking both, at least the first day. But the second day, ibuprofen was my friend. And also making sure you gargle with warm salt water. The first day of extractions, you can't spit whatever you do, so you're going to just get you some warm salt water, swish it around your mouth slowly, lightly, and then just kind of put your head over the sink and let it kind of fall out. It's important not to spit. But I'm going to keep making videos. My next video, I want to talk about having your implants exposed. I wasn't prepared when I went in to have mine exposed. I did not know what to expect. I really didn't think it was a big deal. And I was mistaken. So I definitely want to talk about that, because I know a lot of people that follow me have had implants put in, and they have not had them exposed yet. And I want to, I definitely give you some pointers that I wished I would have known. I wished I would have been more prepared. So if you all have any questions or comments, or have any questions at all, leave them in the comments and I will respond to you. Please subscribe. If there's anything that you are wondering, or if there's something you want me to cover or talk about, let me know in the comments as well, and my next video, or the video after next, and I'll do a video on that. I hope you guys have a great day, and thank you for watching.